Dr. Andrew Baker is a board-certified anatomic, clinical, and forensic pathologist. He is a fellow of the College of American Pathologists. He is a fellow of the American Academy of Forensic Sciences and has previously served as chair of the Academy's Pathology Biology section. He is a fellow of the National Association of Medical Examiners and has previously served as the president and chair of the board of directors of that organization. A veteran of the U.S. Air Force, Dr. Baker began practicing as a full-time forensic pathologist with the Hennepin County Medical Examiner's Office in Minneapolis, Minnesota in 2002. He was appointed to the position of Chief Medical Examiner for Hennepin County in 2004. In 2013, Dr. Baker's office expanded to provide all medical examiner services to Dakota and Scott counties in the metropolitan Twin Cities area. In 2014, Dr. Baker was appointed to the Forensic Science Standards Board of NIST. Dr. Baker.
As you step into your medical examiner's office this morning, the first case for your consideration is that of a 22-year-old woman who was found dead on her couch in her locked apartment. Her coffee table is littered with letters for upcoming medical appointments. A phone call to her physician discloses that she suffered from severe myocarditis as a teenager, leaving her with an irreparably damaged heart. Most of the last several years have seen her in and out of the hospital, with top cardiologists precariously managing her worsening congestive heart failure. She was preparing to enter hospice for what would have been the last few weeks of her life. Is any of that history useful to you? Did it bias you? Would you tell your investigators to bring her body into the medical examiner's office for a complete post-mortem examination? Your next case today is also that of a 22-year-old woman. You learn that police went to her apartment because her family requested a welfare check. Police had to break down the locked door to her bedroom to get in. She was found on the bed, slumped over with a syringe, a lighter, a burnt spoon, and a small bag of white powder near her body. Her family tells the police their daughter had been to chemical dependency treatment several times for her heroin addiction. Is any of that history relevant to you? How did it bias you? Would you request a homicide detective should attend to the autopsy and demand that crime laboratory personnel process the scene? As it happens, your last case today is also that of a 22-year-old woman. You learn from police that she was found nude, dead behind a thicket of bushes in a local park. Torn jogging clothing is found nearby, and the homicide detective who comes to the autopsy relates to you that witnesses heard a woman screaming in the middle of the night. Should the police have shared any of that information with you? Did it bias you? Would you collect fingernail clippings, process the body for trace evidence, and collect a sexual assault kit? The police later make an arrest based on eyewitness testimony. Who among you would not call for the firing of the medical examiner that failed to collect the potential DNA evidence based on the circumstances of this death, the very DNA evidence that might have exonerated the suspect and shown the confession to be false? Herein lies the conundrum we face this morning. We call the circumstances and contextual findings that bring patients to our attention the history. If you disagree with the physician's diagnoses and conclusions, you may be tempted to call this process cognitive bias. Forensic pathology is a medical subspecialty built on a foundation of science, training, experience, and judgment. We obtain a history to generate hypotheses about what diseases or injuries a decedent might have. We confirm or refute these hypotheses by performing a physical examination and utilizing diagnostic tests to formulate medical diagnoses. The history forms the context in which these tests and data are interpreted, and the autopsy is the physical examination which, when correlated with these studies, ultimately yields conclusions that we call diagnoses. But the autopsy is neither a monolithic process nor a simple quantitative laboratory test. And the need for historical information in forensic pathology is even broader than its connection to the autopsy. Historical and circumstantial information is used to determine whether a case even falls under medical legal jurisdiction, and if so, whether an autopsy is warranted. This is the practice of medicine. The importance of history and circumstances in medical diagnosis is sometimes misunderstood by those who are not physicians. Studies have been replicated many times that invariably show that the single most important factor in reaching diagnoses is the history. To misinterpret the importance of history and circumstances in medical diagnoses as cognitive bias represents a profound misunderstanding of the inferential processes in medicine. Several things about forensic pathology set it apart from most other forensic disciplines. Foremost is that forensic pathology is the practice of medicine. In all of medicine, physical findings and diagnoses often make sense only in the context of the history. Autopsies interpreted in an information vacuum yield only clues as to the cause of death and rarely to the manner of death. Forensic pathology is largely a descriptive rather than comparative or quantitative discipline. We do not calibrate tool marks or bullets. We do not compare tire tread patterns. We do not use mass spectrometers to measure drug or medication levels. Forensic pathologists make diagnoses of cause and manner of death, documenting a myriad of injuries ranging from trivial abrasions to fatal gunshot wounds and diseases ranging from incidental heart disease to terminal cancers. It is not the forensic pathologist's role to place a suspect at a crime scene by concluding that two fingerprints match or place a defendant with the decedent via DNA comparison. The forensic pathologist is charged with explaining what happened to the decedent, but is not responsible for opining who brought that death about. Forensic pathology supports many interests besides the criminal justice system, families, public health, and public safety, to name but a few. While it is understandable that defense attorneys might see forensic pathologists as always testifying for the prosecution, this biased view arises because they are largely unaware of the 90% or more of sudden, unexpected, and suspicious deaths, autopsied and certified by forensic pathologists, in which a thorough medical legal investigation leads to the logical conclusion that the death was not a homicide. In such cases, there is no accusation leveled, no trial, no waste of human effort or resources trying to convict an individual of a crime that never even occurred. Neither prosecutor nor defense attorney will know of these cases, and yet the forensic pathologist has been the star for the defense. Cognitive bias may be manifest in several forms. Motivational bias is that which consistently appears to favor one side. Spectacularly tragic examples from crime laboratories, including large-scale scandals related to individual analysts, have resulted in scores of dubious convictions in which questionable or doubtful findings were always interpreted to favor the prosecution, or they were withheld from the defense. One could certainly debate whether fraud on such a scale could be regarded as wholly subconscious. Role effect bias occurs when people's perceptions of their roles in a larger organization influence their decisions. Analysts in police crime run labs may view themselves as members of the law enforcement agency or as part of the prosecution team. Confirmation bias occurs when we seek information that tends to confirm our hypotheses and theories, while at the same time failing to search for counterexamples or ignoring or downplaying falsifying information. Contextual bias occurs when extraneous information influences a decision, typically in cases of ambiguity, even when we know we should not be taking that extraneous information into account. Presumably, it is the conflation of history, as used in the medical sense, and contextual bias, as used in cognitive science, that concerns our legal colleagues when they raise the specter of cognitive bias in forensic pathology. In the amicus brief filed with the U.S. Supreme Court that Mr. Scheck referenced during his presentation today, one of the signatories was the Innocence Network. One of the themes woven through that brief was so-called cognitive bias in forensic pathology, the same issue explicitly stated in the original title of Mr. Scheck's presentation. In that amicus, the authors wrote, like other forensic sciences, forensic pathology is susceptible to cognitive bias, human error, and incompetence. Moreover, forensic pathology is particularly susceptible to cognitive bias due to the subjectivity of autopsies and the way they are generally conducted. In that amicus, the authors summarized 6 cases in which no one would dispute that a flawed investigation led to a disastrous outcome. Viewed through this morning's lens, though, the issue at hand is whether these miscarriages of justice were a result of cognitive bias or stemmed from far more sinister, yet glaringly obvious flaws. Mr. Scheck and I clearly find common ground when we agree that these egregious failures of the system led to tragic outcomes for innocent defendants. Furthermore, Mr. Scheck acknowledges that at least some of the examples in the Supreme Court brief are not examples of cognitive bias. They're examples of incompetence, fraud, and corruption. And while I am relieved that someone of Mr. Scheck's considerable influence recognizes this, it is clear that we have peers in the legal and forensic science communities who are all too quick to jump on the cognitive bias bandwagon, failing to recognize the concepts of legitimate historical and investigative data and distinguishing these from bias. Compounding this by lumping incompetence, fraud, and corruption under the catchphrase cognitive bias only dilutes the meaning of the latter term, impedes research on actual cognitive bias, and does not further our mutual goals of addressing the genuine flaws in our courts and our death investigation system. So here are the 2 key problems that we confront this morning. Failure by non-physicians to recognize that legitimate history is not cognitive bias, and failure to separate the neutral term cognitive bias from the pejorative accusations of incompetence, dishonesty, fraud, and corruption. Utilizing historical information as a means to generate medical hypotheses, develop and prune differential diagnoses, and drive additional diagnostic testing is the cornerstone of every medical specialty. Overt failings such as incompetence, dishonesty, fraud, and corruption do not constitute cognitive bias. As renowned cognitive psychologist Ideal Dror has written, bias is not an ethical issue. It results from the very making and processes carried out in the brain and the architecture of human cognition. Bias cannot be turned off or on by mere willpower or awareness. However, proper training by cognitive experts can play an important role in minimizing bias. Many enterprises that require subjective decision-making have benefited from the input of cognitive experts, and there is no a priori reason that this could not be true in forensic science and pathology. But until our colleagues stop conflating cognitive bias with incompetence, fraud, and corruption, resistance from the forensic science community will be completely understandable. NAME, the National Association of Medical Examiners, endorses research in the role of contextual bias in forensic practice, but we must urge caution in the arena of contextual information and forensic pathology, always mindful that forensic pathologists are physicians who operate in a medical paradigm of using a clinical history and information about the circumstances surrounding a death to generate hypotheses about potential causative injuries and diseases. The autopsy and laboratory examination allow a forensic pathologist to confirm or refute these hypotheses and reach medical conclusions. Performing autopsies is the practice of medicine. This week and this morning, you've heard of sequential unmasking, the process of sequentially revealing relevant information at the appropriate time during the course of an investigation or an analysis. It is not difficult to imagine why a DNA analyst should be kept unaware until after her analysis is complete that shoe prints consistent with the suspect's footwear were found at a crime scene. But how would sequential unmasking be practical in the practice of medicine? Even more importantly, who other than a physician is even qualified when evaluating a patient or performing an autopsy to decide what information is relevant and what is not, and when that information should be made available? Withholding information about a deceased overseas aid worker's fever and travel history endangers the public health when no autopsy precautions are taken and no cultures are collected. Blinding the pathologist to the fact that a young woman was found nude in a park does little good when revealed after the autopsy is completed, the sexual assault kit is never collected, and the body has been cremated. Depriving forensic pathologists of historical and contextual data, or worse yet, relying on non-physicians to spoon-feed medical experts only those bits of information they believe relevant at the time they deem appropriate, will perpetuate initial biases formed by each side in a legal dispute. Rather than serve justice, such an approach would assuredly produce more failed investigations, unrecognized homicides, and wrongful convictions. No one would claim that cognitive biases cannot or do not occur in medicine. Physicians are no more immune to cognitive biases in their professional lives than any other occupation. But again, cognitive bias and legitimate histories are different things, and no one is better positioned or more thoroughly trained in distinguishing relevant from irrelevant medical history than a physician. While not always perfect, any other approach would fall short in comparison. If our legal and cognitive colleagues want the forensic pathologist role in the criminal justice system to be as free of bias as possible, our professions could work side by side to produce better outcomes and fewer miscarriages of justice on a number of fronts. Work to effect the transition from elected coroner systems to independent, appointed medical examiner systems. Not being elected helps insulate the certifier of death from the whims of public opinion and from political pressure. The Innocence Network's brief cited the 2009 NAS report when it observed that electing death investigation officials may lead to difficulty in making unpopular determinations of the cause and manner of death. Push for increasing the number of qualified forensic pathologists. Far too few medical students are choosing pathology as a career, and fewer pathologists will mean fewer forensic pathologists. Worsening the shortage of forensic pathologists and converting those remaining into mere technicians, deprived of meaningful historical data upon which to base opinions and diagnoses, will degrade the performance of autopsies and the quality of death certification. It will undeniably drive good people from the profession, leaving a void to be filled by less qualified individuals. Lobby for model medical examiner legislation and incentive-based funding for facilities and personnel that would assist states in converting antiquated and fragmented death investigation systems into modern, nationally accredited medical examiner systems. Drive the effort to ensure that all forensic practitioners are trained and certified in their fields and that all forensic science laboratories, including medical examiner and coroner offices, are accredited to recognized national standards. Most importantly, work with your state legislatures or the courts to produce legislative or judicial guarantees that medical examiners are independent of law enforcement and prosecutors and available to all sides in the criminal justice system. If your concern is overzealous police and heavy-handed prosecutors being the sole drivers of death investigation, the best check and balance is an independent medical examiner armed with all case information, operating a medical model of death investigation in parallel. And if a defense attorney cannot or has not met with the pathologist prior to her appearance in court, then this arm of the justice system has failed. Even though medical examiners in my home state of Minnesota have been statutorily independent for decades, that independence was sorely tested several years ago. One of my colleagues had her employment threatened by a prosecutor because one of her assistant medical examiners agreed to look at a high-profile murder case from another jurisdiction for the defense. At the same time, the legal counsel for Minnesota sheriffs wrote that sheriffs and county attorneys should consider what to do about independent medical examiners in their own jurisdictions, going so far as to suggest that medical examiners be contractually forbidden from doing any work outside their county. The murder case that sparked this controversy made its way to the Minnesota Supreme Court. In ordering a new trial for the defendant, the Minnesota Supreme Court wrote, "If Minnesota's law enforcement and prosecutorial communities believe that medical examiners are not independent, autonomous, and neutral actors, we now state clearly that such a belief has no place within Minnesota's criminal justice system." Imagine the benefit to our justice system if every medical examiner in every city, every county, every state enjoyed that level of protection. The 2009 National Academies of Science report published its recommendations to strengthen the forensic sciences, explicitly stating that the best science is conducted in a scientific setting as opposed to a law enforcement setting. The report specifically recommended that medical examiner and coroner offices should be independent from law enforcement agencies and prosecutors' offices. This recommendation was immediately and forcefully endorsed by NAME. The standards of NAME state that medical legal death investigators must investigate cooperatively with, but independent from, law enforcement and prosecutors. The parallel investigation promotes neutral and objective medical assessment of the cause and manner of death. The NAME standards also state to promote competent and objective death investigation, medical legal death investigation officers should operate without any undue influence from law enforcement agencies and prosecutors. NAME has a published position that it is imperative that forensic pathologists and medical examiners remain independent officials and be available for consultation for both prosecuting and defense attorneys throughout the United States. Many of my peers in the jurisprudence section appear to believe, quite sincerely, that we live in a world where medical examiners regularly capitulate to the demands of prosecutors, crafting autopsy reports and formulating opinions, no matter how scientifically indefensible, to fit the narratives provided by manipulative law enforcement officers eager to rapidly close cases by railroading innocent men and women. The brief that we've mentioned this morning bemoaned, as though this is commonplace, the pressure put on the report's author by a detective standing over his or her shoulder in the autopsy room to corroborate a detective or prosecutor's case theory. That dystopian view, which is certainly not my medical examiner's office, is not a world where cognitive bias is the problem. That is a world where incompetence, overt corruption, and lapses in ethics, all fueled by a lack of medical examiner independence, is the problem. We should all be operating in systems where fiercely independent medical examiners regularly look their legal peers, law enforcement colleagues, and jurors in the eye, clearly and confidently explaining why theories about a case do or do not comport with the medical findings. Stripping or limiting pathologists' ability to obtain, assess, and weigh historical information related to death investigations will result in miscarriages of justice, not only in the form of misguided law enforcement practices, wayward prosecutions, and wrongful convictions, but in the failure to even recognize many homicides or threats to the public health. Such an approach is an abrogation of the public trust we have, it is bad jurisprudence, and it is bad medicine. If you want a medical legal system as free of bias as possible, then work with that system to ensure the highest standards and guaranteed independence of medical examiners and forensic pathologists. I'd like to close with this thought. What we have failed to do in this country is develop a tradition where forensic science is an independent brute force in the criminal justice system. And you know, the only thing that would make this thought better would be if a medical examiner had said it. Thank you.
What a spectacular program we've witnessed here this morning. This has just been awesome.